So we're just describing the process for how we're going to treat the eye bag. So I'm going to ask you to look up if you can. Just look up towards the ceiling. Perfect. So you can see, if you bring your head down a little bit, so you can see this side, you've got a little bit of the fat pad, the suborbicularis oculi fat pad here, and a small indentation on the outer part here. But the right side is much more puffy, so there's a lot more edema here. So essentially what we're going to try and do is we're going to try and blend out the bag. Obviously surgery is a preferred option, essentially, in terms of like the ideal option, the gold standard, but obviously there's lots of risks with surgery, and that's why people opt to do dermal fillers, to try and blend the eye bags out. So what we'll do is we'll have an entry point from here to try and blend out the inner part, an entry point from here to try and blend out the lower part, and then we may choose to do an entry point from here, or even from here just to go outwards to fill out the last part here. Essentially what we want to do is something a bit more like that. That's what we want to achieve. You'll still see some hint of puffiness, but it will be much more blended in, and then we'll add some additional supportive treatment here just to kind of pick up the lowest part to get a bit more fullness in the malar fat pad there. The left side actually also needs a little bit of work, but less so in the medial aspect, more in the lateral aspect, so we'll just end up replicating the treatment. But as you can see, it's slightly asymmetrical with more puffiness on the right than the left, so that's what we're going to do. All right?
All right.
All right, brilliant.